Welcome back, everyone. Now we are moving on to the plenary session. I would like to invite Professor Dr. Zulkifli bin Haji Yahya to invite our first speaker, Professor Dr. Syed Muhammad Al-Junaid.
Thank you. I will introduce a brief CV of Professor Dr. Syed Muhammad. Professor Dr. Syed Muhammad Al-Junaid is the first professor of health economics in Malaysia. He is the first Malaysian to obtain PhD in health economics from London School of Hygiene and Tropical Medicine in 1995. He obtained his PMD from National University of Malaysia and Master of Science in Public Health from National University of Singapore. He is the founding head of International Center for Case Mix and Clinical Coding, a center of excellence on case mix and health economic research in Faculty of Medicine, UKM, which was established in 2011. Prior to this, he served as a senior research fellow of United Nations University International Institute for Global Health from 2006 to 2014. Currently, he is appointed as the founding professor and chair of Health Policy and Management, Faculty of Public Health, Kuwait University from 1st January 2016. He is also the director of postgraduate programs of Faculty of Public Health, Kuwait University. He is now appointed as a consultant and advisor to Ministry of Health of Kuwait on the control and prevention of COVID-19 pandemic. His main interest is in the strengthening of healthcare system of developing countries through research and development in health policy, health economics, and financing. He has conducted more than 50 research projects, most of which are to support policy decisions on health economics and financing. He has supervised 45 PhD scholars and more than 100 master students. He is currently involved in supporting a number of developing countries to implement social health insurance programs. His work on social health insurance covers many countries around the world, including Malaysia, Indonesia, Philippines, Mongolia, Vietnam, Bhutan, China, Saudi Arabia, Kuwait, United Arab Emirates, Sudan, Nepal, Uruguay, Iran, Chile, Kenya, and Ghana. He served as the co-chair Mobility Technical Advisory Group of ICD-11, revision of World Health Organization, Family of International Classification from 2007 to 2016. He is the founding president of Malaysian Health Economic Association and Malaysia Society of Pharmacoeconomics and Outcome Research, and the current deputy president of the Public Health Medicine Specialists Association of Malaysia. He has published more than 200 journal articles, book chapters, and scientific reports with 20,058 citations and each index of 45. He has presented more than 250 papers in local and international conferences, seminars, and workshops. He has authored and co-authored 8 books. His recent book is using case mix for hospital reimbursement in social health insurance program, comparing case mix system and fee for service as provider payment method. Having listened to his CV, it is very appropriate for Prof. Dr. Syed Muhammad to talk on the topic COVID-19, the post-pandemic health system scenario.
Assalamualaikum warahmatullahi wabarakatuh, and very good morning to everyone. First and foremost, I would like to thank UniSHAMS for inviting me to present this plenary paper in this very important conference. And the topic that I will cover today is on COVID-19, the post-pandemic health system scenario. In this talk, I will cover the following areas. I will briefly discuss the current status of COVID-19 pandemic that affect Malaysia and also many other countries in the world. And then we will talk about the focus. We will focus on the COVID-19 pandemic on the overall health system, and we will review the previous pandemic that have occurred in the past number of centuries, and then and decades, and see whether what we can learn from them, and when we can probably anticipate that the current pandemic might ends. We will review on the public health intervention, and then I will talk about the scenario that occur after the pandemic, the post-pandemic scenario, and I will then provide you my views on the reform in the health system. So up to 2 days ago, 29 July, we have nearly 196 million cases worldwide with 4 million deaths. Currently, we have 14 million active cases. And the top 5 countries in the world that have most number of cases are the United States of America, India, Brazil, Russia, and France. And of course, these are all big countries. And many of these countries are doing a lot of efforts in order to manage this pandemic. In ASEAN countries, we have 7 million cases at the moment. This is up to yesterday, 31st July. And of course, 3 top countries in the region that have most number of cases are Indonesia, Philippines, and of course, Malaysia. All these three countries have got more than 1 million cases in total. We hope that things will be getting better in the next few months. In Malaysia itself, we start to record more than 1 million cases. This is on the, I think, 25th of July. And until yesterday, we have cumulative cases of 1.1 million cases. And up to today, which is 1st of August, we have 17,000 cases, new cases per day. From middle of July onwards, Malaysia has recorded more than 10,000 cases per day, which is a big number. And so far we have about 9,000 cases of death. So these are the situation that we are facing at the moment in terms of the COVID-19 pandemic. And globally, the coronavirus pandemics are considered to be one of the worst epidemic that we have since last decades. And the economy of the world has contracted so much, which is 5.2% this year, and it might create one of the worst recession in the last 80 years. And the situation are still unpredictable with a lot of uncertainty around this. And if you look at the stock market, most of the major stock markets in the world have gone down quite a lot, especially in the past few months. The impact on COVID-19 on health system are a lot. I think if you look at all these various components, we know that we have issues regarding funding. We have issues related to train human resource to manage the pandemic itself. We are also struggling with information and evidence to support the action. There is a negative impact that we can observe in terms of the overall delivery of the health services, COVID or non-COVID cases. There were issues related to weaknesses in leadership and governance that faced by many countries in the world, including Malaysia. And we are also concerned about the overall impact on the Sustainable Development Goals that has been developed by United Nations in order to prevent major variables that are affecting the economy, including poverty, infectious disease, and all things which are affected by COVID-19 pandemic. If you look at over the past few centuries, we can see that these are the situation in terms of the pandemic that we have faced before. Most of this pandemic normally ends within 2 or 3 years, but COVID-19 might be one of the worst pandemic that we have seen so far because of the size of the population that are affected, and also in terms of the countries that are affected by this. And it might probably take more than 2 to 3 years, what we have seen in the past decades when the world are hit with other form of pandemic. As any other pandemic, COVID-19 pandemic is being managed by using public health intervention. This includes the primary, secondary, and tertiary prevention. At the moment, we can see a lot of effort has been put in on primary and also secondary prevention. Primary prevention includes the movement control order, the physical distancing that has been promoted to reduce the transmission of the diseases, use of facial masks, personal hygiene like washing hands and all that, and quarantine. And one of the most important primary prevention that most countries are focusing now is on vaccination. At the same time, secondary prevention includes testing, and now we are starting to have a new modalities of testing using not only PCR, but using more simpler form of technology where people can test at their home, which is the testing that can be done by patient by the community themselves at home. And then early treatment, especially for cases that require intensive treatment, we try to get them treated very fast, as fast as possible, although the hospitals are having a lot of difficulty in managing these cases. And of course, tertiary prevention, especially on disability limitation and also rehabilitation. This is very important, especially more and more information we are getting now on the effect of long-term consequences of COVID-19, which is called the long COVID-19. This is going to affect the people who are affected by this by COVID-19 and who have actually managed to survive from this condition. In terms of the post-pandemic scenario, I want to focus on these issues. We are going to look at the public health system, the hospital services, what would we expect in terms of health human resource, and we also have to look at the issues on how do we manage in the future our health information system, how do we actually move forward to reform our health system to take into account of the damages done by COVID-19, and also the focus on the need of for the country to go towards the research and development. In terms of public health services, one of the important component of public health services which relate directly to the management of COVID-19 is on the improvement in the surveillance system. As most people who are working in public health services know that the surveillance system are required in order to enable us to detect the disease as soon as possible, to isolate them, to test for more cases, and also to manage these cases. We need this in order to do fast action to manage it. And we need in the future to improve this surveillance system in order for us to ensure that we can evaluate the impact of the current pandemic, and also to monitor the long-term epidemiologic trends of COVID-19. However, we need to improve this by enhancement in the surveillance system through improvement in the data management. We already have technology like artificial intelligence. So in the future, we should be able to use this information to actually predict new cases and probably able to detect and also assess how effective the current and also the future prevention are. And if we have a good surveillance system, we would be able to develop the early warning system, which is very important in anticipation of the new wave of cases. One of the important aspects in primary prevention is the contact tracing. And if you know that contact tracing requires huge amount of human resources, and the issue is how effective are the current contact tracing. So in the future, we have to actually look into this. The classical way of doing contact tracing is to do what we call the conventional approach is to do prospective approach, where whenever there is a new case being detected, then we follow up upfront to look at the new context. But by using information system and also artificial intelligence, The more innovative approach is to use what we call the retrospective contact tracing. This is to focus on the source of the case that spread the disease and try to actually look at where the context has been before he got the disease, rather than looking at it prospectively. It was proven to be effective in Japan, in Korea, and also in some other countries. So in the future, we should actually try to use this approach rather than using the conventional prospective approach in contact tracing. Previously, when we have surveillance system, we use notification form, where these notification form are sent to the public health department. Nowadays, with the information technology, I think in the future, the notification method will be changed using the internet and also the information technology. Other issues that we need to look at in the future is actually to enhance our enforcement of regulation. This is one of the primary prevention, which is quite important. The current rules and regulation must be updated. We should try to rectify all the weaknesses. And there were issues related to the equity in the enforcement activities, where people of the influential people in the community who actually flout the rules were not being punished as it is, and they escape the severe punishment compared to those who are the poor and also those who are at the normal population. This needs to be improved in the future if you want to use regulation effectively to manage the pandemic. Health promotion is an important aspect that we need to enhance in the future. We need to provide accurate and updated information to the public. We need to actually to mobilize the community and to provide a clear and accurate guidelines on how to conduct the preventive activities. And at the same time, we need to actually improve the coordination between the central and the periphery agencies in order to carry out health promotion activities. These need to be improved if you want to move forward for the future to manage the pandemic properly. Of course, vaccination program is one of the very important tool and has been proven to be effective. In the future, we need to actually revise the essential program in immunization. So probably in the future, we need to include COVID-19 vaccine as one of the regular vaccination program in our EPI. There are studies has been carried out in order to look at the needs for these booster doses. At the same time, the need for this vaccine for children. And I think with the new variants coming up in the population, we need to actually revise the current immunization program and be prepared for the new revision in the EPI. There were a lot of campaigns by the anti-vax group that actually provide a lot of fake information to the community. So campaigns have to be carried out intensively to counter this action. And the other important issue related to vaccination is the use of what we call the vaccine passport. At the moment, people who are traveling from one country into another are facing a lot of problems because some of the vaccines that are given in some countries may not be recognized in other countries, and the vaccines passport that are being introduced or used by one country may differ from other countries. So issue of vaccine passport is very important if you want the economy to be back and to be up and running after the pandemic is over. Currently, we'll see that the rich countries are dominating in terms of the coverage of the vaccine. Poor countries, we have lack of resources. Those with middle and also lower income country and low income countries, you can see the coverage is much lower because the health system is still do not able to provide enough resources to get the vaccine. In Asia Pacific, we can see smaller countries like Bhutan, Maldives, Mongolia, they have achieved and Singapore, they have achieved quite a good coverage level, more than 50%. But other countries, bigger countries, and also lower income countries in the Asia region, we are still struggling to achieve a good vaccination coverage. And it is hoped that this country will achieve at least 50% of the population being covered. Malaysia, as of today, we are trying to achieve 50% coverage among the adult population by the end of this month. And I hope that we will be able to achieve this with the modification in terms of the vaccines strategy that we have. At the same time, in terms of vaccination, we do have people who actually exploited the current situation, and because the vaccines are very scarce, there were issues of vaccine being stolen and being sold in the black market. This is another issues that many developing countries have to actually solve this. And then there were issues where vaccine were given given to the population at the Center for Vaccination Program, but some of the vaccines were not properly given, and this creates loss of trust among the population on the vaccination program developed by the government. So this have to be again sorted out, and we have to take appropriate action in order to avoid this happening in the future. With the occurrence of the new variant, especially the Delta variant, which are supposed to be was found to be more highly infective, 5 or 6 times more infective, more infectious compared to the other variant. This will actually lead to a huge number of cases in the population. So more activities need to be carried out in order to manage this, including increasing the coverage of the vaccine. At the moment, most of the vaccine are still able to prevent all these new variants from being spread in the population. For cases that has to be admitted, especially those in category 4 and 5, hospital services in many countries has been stretched to the limit. In Malaysia itself, we know that our ICUs are full. At the same time, the staff are being stretched to the limit. So in the future, we need to actually have a proper management of the ICU services, and we have to actually move towards use of a proper medical record system, for example, electronic medical record. We have to enhance the quality assurance program, especially when we have a lot of cases that died as a result of COVID-19. In order to reduce variation of care, hospital services should actually carry out effort to develop clinical pathway in order to reduce the variation of care, which might have an impact on quality assurance program. Deaths occur in hospitals should be subjected to medical audit in order to find out where the weaknesses are. When the services are being outsourced to the private sector, which is an important aspect in public-private partnership, that we have to actually enhance these referral services so that when cases are being referred to, there are mechanisms to actually trace these cases, and at the same time, there are mechanisms to pay the private sector when the services are being managed by the private hospitals under the public-private partnership. If you look at the cost of treating COVID-19 in Malaysia, this is cases that does not require ICU. It ranges from 2,000 ringgit to 3,000 ringgit, depending on the severity level 1, 2, and 3 on the case mix classification, which actually requires between 4 to 6% of per capita GDP. But of course, when these cases need ventilator, need respirator, then the cost jumps up to nearly about 10 to 20 times higher than the non-ventilated cases, which is from 30,000 ringgit per admission to as high as nearly 20,000 ringgit. So this is these costs are obviously will not be affordable by most of the population in the country. So government must actually have a mechanism in order to provide the resources enough for us to manage these cases. When cases are admitted to ICU, the cost per day of staying in ICU is very huge. For example, here, this is the cost of ICU services in one of the teaching hospitals. The highest is actually the general ICU, which is 5,000 ringgit per day of stay, followed by the coronary intensive care unit. But you can also see that even PICU and also the pediatric ICU can also be quite expensive in managing this. This is the cost per day of stay in the ICU. Another important aspect that affects the affected by COVID-19 is our health human resource. We do not have enough human resource that are being trained initially at the beginning of the pandemic to manage the COVID-19. The staff were not adequately trained, but at the same time, we do not have enough protective clothing at that time. The PPEs, it was not adequate, but now I think this has been sorted out. There were also issues in some countries that the healthcare workers face social stigma in the community they were not accepted by the community, and in some country they were chased out of the place where they stay because people thought that they will bring diseases to the community. But of course, in Malaysia, this is not the case. So the staff need to carry out preventive and promotive activities apart from the curative services. And we can see that some countries have recorded quite a big number of health workers that succumbed to COVID-19 because they were exposed at their workplace. And it was estimated in the last year that at least 7,000 health workers worldwide died because of COVID-19. This was last year, but I'm sure now we have a lot more than that. At the same time, staff were overworked. There were issues in many countries that staff suffer from what we call burnout during the COVID-19 because of the long working hours in a very uncomfortable environment with wearing the PPEs, which is not comfortable at all. So all this actually is an important bearings in our healthcare system. Other delivery of the services such as other primary care services, maternal and child health, and also management of chronic non-communicable diseases to a certain extent been affected by the focus that are given more to COVID-19. So staff are deployed from the usual services to cover COVID-19 cases. As a result, some of these important services might be neglected. Surgery has been postponed in many hospitals. So all this actually will lead to, in the future, there will be a lot more non-communicable diseases with complications that need to be managed by the doctors and healthcare staff in the health system. The other issue is how do we manage our health information system? This is very important. In many countries, at the early part of the pandemic, people are struggling to get accurate information on to report this to WHO. There are some variations. Some countries are still having problem to report the cases properly. At the early part of the pandemic, some countries like China, for example, they reported cases only if the cases are positive with symptom. Those who are cases which are positive without symptom are not reported. So this variation in reportings make it more challenging for WHO and also international organization to keep track on the cases. At the same time, health information that are being collected by Ministry of Health in many countries, including Malaysia, were not actually being shared with other people. This is what we call silo mentality, where not sharing of information for various reasons have led to actually delay in the action being taken, especially by the community and also by people at the ground level to help the government to manage the pandemic. There are many reasons for lack of data sharing. One of it is the fear that it might expose the weaknesses that are faced by the government that are involved in collecting the information, fear of losing power, and there were also issues where there was no clear guideline and also approval to share this data with other interested parties. So in Malaysia, we can see that state of Selangor, where the most number of cases of COVID-19 is happening, but the government of Selangor are not able to actually assess or get the information for them to actually support the government to carry out these activities. And this is something which are required to be addressed in the future. So people are calling for what we call the transparency in the COVID-19 data in order for the expert outside Ministry of Health to help to manage the situation. We are also having problems regarding the use of proper evidence for policy decision. The quality of research and also data are very important in order to guide the policy decision. And of course, some people try to provide the information which are not based on evidence-based practice and leads to a lot of confusion. So this is the basic information that we know that good information is required whenever we want to take appropriate action. Currently, one of the things which are being debated is the case of the use of ivermectin. At the moment, we know that the information available for the use of ivermectin on human to treat COVID-19 is not adequate to support a proper decision making. And there were a lot of evidence to show that this drug, although it is very cheap, but it doesn't have a positive effect on controlling the pandemic. And even it can be dangerous because the doses that are required to actually manage this in human will be very high, and it might lead to side effects and also some other adverse situation. And many people who are actually in favor of ivermectin try to provide information, and many of this information are not actually of high quality. Another important aspect that we must look at in the future is to focus on research and development. This includes activities for us to develop our own vaccine, and Malaysia is in this particular direction at the moment, trying to develop our own vaccine, because we cannot depend all the time on vaccine which are being developed by other countries, because the supply will not be adequate. At the same time, the costs are going to be high. There were also research required in terms of the new modalities of treatment, including using new drugs, new antiviral drugs, and also recently there were reports that we can use monoclonal antibody to manage severe cases, class 4 and class 5, or category 4, category 5 of COVID-19. And also policy-related research to actually guide us what are the effect of other intervention. And this is the situation in Malaysia. We are IMR with their partners are trying to develop the vaccine, and we hope that by 2024 we would be able to get our own supply of vaccine that can help to mitigate the problem. In terms of the overall health system, we probably need to look at the potentials of reforming the health system. This is because one of the issues is on health financing. The government has introduced introduced the economic stimulation package within the health sector and outside the health sector, with a value of 530 billion ringgit, which is equivalent to nearly about 23% of the GDP. This is huge amount of money that being put into the system. And in terms of the health sector, the government allocate 3.7 billion for the other resources, and 3.9 billion for vaccine. So nearly about more than 7 billion ringgit has been allocated. This is probably more than 10% of the, it's more than nearly about 20% of the overall health expenditure, which is huge amount of resources. And in the future, the government might want to actually relook at the introduction of the national health insurance to raise adequate resources. As we know that countries we have got a social health insurance program are able to manage this pandemic better than other countries that do not, that have to depend on other form of health financing. Another important aspect of health system reform is the need to decentralize the health system. So the advantage of decentralization is that it might lead to fast action at the local level to manage some of the COVID-19 pandemic effect. It is easier to mobilize the resources, and action can be taken based on the local context. For example, here, this is the campaign for the white flag, where people, the community themselves organize to provide support to the population and also households that are having problems during this pandemic lockdown. The disadvantage of decentralization includes lack of technical skill for people on the ground level. There were also limited financial resources that can be mobilized by the population, and sometimes there might be situations where the local leaders might exploit the situation. And of course, to have a proper and sustainable long-term effect of decentralization, it had to be properly monitored. Another important aspect that we have to look at is corruption in the health system during pandemic. During pandemic, government normally are more lenient to approve purchases for emergency use. This is to actually provide fast action to develop, to provide the required mechanisms for us to manage the pandemic. However, there are situations where this will lead to abuses by parties who are not responsible, and it will lead to poor quality product being produced, and it might cover other things like drugs, IT supplies, and all that. So we need to make sure that this money that are being allocated by government, the total of 530 billion ringgit that be allocated, are being used appropriately. We do not want people to actually use this to buy unnecessary services and also unnecessary equipment, which may not be useful for the management of the pandemic. So efforts to control corruptions at the ground level must be carried out effectively in order for us to manage this pandemic in the future. So in conclusion, COVID-19 pandemic is the most catastrophic form of pandemic that appear in this century. The actions taken to manage the pandemic has, of course, adverse effect on socioeconomic of the situation of the population. Health system may not be the same in the future, especially during the post-pandemic era. And we know that vaccination is one of the main primary prevention tools that are proven to be effective in managing the pandemic. We might need to reform our overall health system in order to mitigate the problem and also take into account the impact of the COVID-19 pandemic in the future. With that, I would like to thank all of you. Thank you so much. Assalamualaikum warahmatullahi wabarakatuh.
Thank you, Professor Dr. Syed Muhammad Al-Junaid, for a very insightful session.